Hey everybody, I'm Anthony Selm with MedicareEasyStreet.com,
Jude.
and this is Jude, our special guest. Today's video, we're going to talk about the cost associated with Medicare. Sometimes seniors find it a surprise to find out that Medicare isn't free, so we're going to look at the different costs associated to help you budget and plan ahead. Let's dive in. All right, so we're back, and let's take a look first at the cost associated with original Medicare. And for starters, we'll look at Medicare Part A, which is your hospital coverage. Now, for most of you, you've worked for 10 years or 40 quarters, and you've already prepaid for those benefits. So you're going to have no additional cost to get Medicare Part A, the hospital coverage. If you haven't worked for the 40 quarters, then you're going to have some monthly cost associated. It's up to $413 per month, and it's prorated. So if you've worked for at least 30 quarters but not 40, then they'll prorate it. But if you've worked less than 30 quarters, then the benefit that you get with Medicare Part A costs $413 per month. So it's really good benefits. Don't think of it as something that's free necessarily. Think of it as if you've already prepaid in and you've earned those benefits. I don't like thinking that it's an entitlement. You've already paid for it. But Medicare Part B, on the other hand, is going to have a monthly premium associated. For most of you, that premium, the standard monthly premium, is $134 per month at the time of this recording, at least for 2017. And that premium is paid for medical benefits under Medicare Part B. For those of you with higher incomes, there's a modified adjusted gross income number that Medicare looks at, and if your MAGI is at one of the higher tiers, then you're going to have something called an income-related monthly adjustment amount, which means you're going to pay a higher premium for Medicare Part B. And that only affects about 5% of Medicare beneficiaries, but for those of you with the higher income, I'll show you the chart here on the next page. Premiums for Medicare Part B usually are automatically deducted from your Social Security benefits if you're withdrawing Social Security benefits. If you're not, you can be billed quarterly and just pay that directly to Medicare, or you can set up an automatic bank draft and just pay it automatically from a checking account each month. One important thing, though, here is to understand that in order to get a Medicare supplement plan or a Medicare Advantage plan or any other supplemental coverage with Medicare, then you have to have Medicare Part A and Part B and pay the premiums associated with it. So you may see advertised out there these zero premium Medicare Advantage plans. You still, even with those plans, you still are going to pay your premiums for Medicare Part B, typically speaking. So there's really no free plan out there. You're always going to have at least Medicare Part B in order to get into any other supplemental type coverage like that. So for the higher income people, you can see that the income numbers start at $85,000 for a single person or $170,000 for a couple filing jointly. If you're in one of those higher tiers, then just be mindful of that so that you can plan or budget accordingly. If you're comparing Medicare coverage to a group or an employer-based plan, these are all things that you would want to take into consideration so that you really are knowing if you're comparing apples to apples. Another thing here is they're not going to look at this year, they're going to go back 2 years. So you can see here for 2017, they're going to look at what that modified adjusted gross income was back in 2015. So again, when you're planning ahead, might want to look back at what your income was if it was more than one of these numbers here back 2 years ago. That could affect your premiums for Medicare for this year or for next year. Medicare Part D, your prescription coverage, is not something that you're going to pay for. You're not paying premiums to Medicare for those benefits. You're paying to a private insurance company to get prescription drug benefits under Medicare Part D. But those premiums typically can be deducted automatically from your Social Security check each month, just to keep it simple and avoid another bill coming in the mail or another check that you have to write or another bill that you pay each month. You have the option usually just to have that premium deducted automatically from your Social Security benefits. Similar to Medicare Part B, Medicare Part D also has an income-related monthly adjustment amount based on your income, and I'll show you the chart here again on the next page, but the numbers are the same. The income numbers are based on the same tiers, and that premium or that adjustment amount is paid directly to Medicare. It's not paid to the private company. So if you earn a higher income, you're not paying the insurance company more money for the Part D plan. You're paying that adjustment amount directly to Medicare. And that's something that also usually they can just deduct that right out of your Social Security benefit each month. And that would apply for if you have a standalone Part D plan with a Medigap or Medicare supplement policy, or if you have a Medicare Advantage plan, that Part D adjustment still is going to apply. So for those of you starting at $85,000 for a single or $170,000 and up for a couple, you can see the first tier there has an additional premium of $13.30 per month. The next tier is $34.20. So you can see those additional numbers and put that into your budget for what your Medicare costs will be moving forward. So when deciding how you want to receive your benefits with Medicare, you'll have two choices. And the first option, option number one, is to receive your benefits directly from original Medicare Part A and B. That's going to give you the most freedom. You'll have access to any doctor nationwide that accepts Medicare. There's no network restrictions, no referrals to see a specialist, etc. So it's going to give you the most freedom and flexibility. But since original Medicare doesn't cover 100%, in most cases you'll be looking at buying a Medigap or Medicare supplement insurance. And then you'll also have a premium there for a standalone Part D prescription plan. So that's option one. That would be considered the gold standard. That's what most people do when they can afford it. It's going to give you the most coverage and the most freedom and flexibility. On the other hand, you can choose option two, which is a Medicare Advantage plan. So think with Medicare Advantage as if it were original Medicare benefits, but administered by a private company. So you're going to have some limitations there and some restrictions. It typically costs less per month than a Medigap plan, but that's the trade-off. You're going to have either an HMO or a PPO network. You may have to get a referral to see a specialist. You may have copays and deductibles and out-of-pocket costs associated when you go to the doctor that could be up to $6,000 or $6,700 per year. So option one, original Medicare, more expensive. Option two is Medicare Advantage, less expensive on the front end, but you could end up with higher out-of-pocket costs. So let's just look at some examples here and how those two might compare. So for example, option number one here, and these are numbers that we provided for a client that was comparing the two. Option number one was original Medicare, which was the Part B premium of $134. And then in addition to that, they chose Medigap Plan G, which was $110 per month. And then in addition to that was the premium per month of $34 for the standalone Part D prescription plan. So total monthly premium here was $278 per month. And then after that's paid, the other costs associated throughout the year would be medical expenses and prescription costs. So since Medigap Plan G doesn't pay for the Part B deductible, but pays all other benefits that are not paid by Medicare, then their medical cost at most could be $183 per year. So whether it was a doctor's visit, lab test, heart surgery, knee replacement, whatever else happens, the most they could pay for medical expenses in a given calendar year is only that $183 deductible, the Medicare Part B deductible. In addition to that, they're going to have prescription copays or deductibles that could apply. When we plugged in their medications, it was going to be about another $300 per year in addition to their premiums for the Part D drug coverage. So that's another factor or another piece that you have to factor in, is what is going to be the additional copays and deductibles that you may have for your prescriptions. So we look at in a good year, when we added all this up, the good year, the budget was about $3,819. In a bad year, since the Medigap coverage basically covers everything, it's going to be the same. So whether it's a good or bad year, the healthcare budget is going to be the same with original Medicare plus a supplement and a drug plan. When we look at the Medicare Advantage, they were looking at a zero premium Medicare Advantage plan. So they still are going to pay the $134 per month for Medicare Part B. But in addition to that, that Medicare Advantage plan is able to provide benefits equivalent to original Medicare and the prescription coverage at no additional cost, because those companies receive money from the government to administer that plan. So they're able to pass that down and offer a plan at zero premium. In this case, it was an HMO plan, so it was a narrow network relative to our location here, and had referrals to see specialists and the other restrictions that come with it. But The trade-off there was getting a plan with 0 monthly premium. And you can see the medical cost associated with this plan had a maximum out of pocket of up to $6,700 per year. And then in addition to that, the prescription coverage was about the same because the Part D is built into the Medicare Advantage, but the copays and deductible and the structure there is the same as, or relatively the same as if it were outside in a standalone drug plan. So we look at all those numbers added up. In a good year, they say they didn't go to the doctor, they just filled their prescriptions regularly and went for their checkup. Their total healthcare budget in a good year would only be $1,908. So that beats the option one by almost a couple $1,000s. In a bad year, though, however, because the maximum out of pocket was up to $6,700, if they had cancer treatment or a heart surgery or an extended stay in the hospital, their healthcare budget would be all the way up to $8,600 because of that $6,700 out-of-pocket maximum. So when you look at these 0 premium plans, you do get what you pay for there. You're going to have higher out-of-pocket costs when you use it, and that's why those plans, typically we see some volatility there between what the healthcare costs are from month to month or year to year. This is a good illustration just to show that. You can see at the bottom there, the blue line would represent the premiums paid for a Medicare supplement plan. Those are going to be stable every month throughout the year. And since those plans cover most, if not all, the cost associated with healthcare, there's really not going to be any fluctuation. On the other hand, the red line represents the out-of-pocket cost associated under a Medicare Advantage plan. So let's say with this chart, for example, in February or March, we ended up having to get a cancer treatment or ended up in the hospital for a few days. There's a lot of additional costs there that can be incurred, which creates volatility every month or every year as we go through with a Medicare Advantage plan. But again, that's the trade-off. For the lower monthly premium, you're going to pay for it later if you end up using it, but also the restrictions with doctor networks and referrals to see specialists and everything else, and that can change every year. So that's something where if you are considering Medicare Advantage, you have to really be mindful and a conscious shopper of looking at all those details every year to make sure that you're not going to have as many surprises as if you didn't look at it. So when planning for your cost for healthcare with Medicare, hope this helps you kind of get a better idea what those costs could look like in these examples. If you still have some questions, though, give us a call. The toll-free number's listed here. That's 866-572-9255. I'm at extension 103, and you can just ask for me, or you can send us an email. Like our page on Facebook, though, or subscribe to our channel on YouTube for more informational videos like this and updates with regards to changes in Medicare, and I hope this helps. We'll talk to you soon.